believe some people will say the white population want to increase our reproductive potential. So there is a lot of misconception and misinformation. Yeah, we also have stockouts and cold chain failures, especially we always receive people from our health, especially here at Wakiso Health Center for that come to buy some vaccines from our facility. But if you find someone who cannot afford, they will miss their dose. So missed appointments by caregivers. Sometimes you tell someone that you will come for the second dose on this day, someone doesn't appear. Why immunization matters: prevents disease outbreaks, reduce childhood diseases and disabilities, builds the herd immunity, saves treatment costs for families and government. So, for my concluding remarks, immunization is for everybody, so including we, the health workers. So all of this, as far as immunization is concerned, we have to educate patients about the schedules of immunization. We have to encourage the completion of doses. We have to fight
vaccine available best one. So Dr.
Thank you, I'm coordinator. My screen visible to everyone. Shakira? Yes, Madam Coordinator, is my screen visible to everyone? So the document about the Yes, Shakira. Yes. Hello, hello. Is my screen everyone? Hello, am I clear and is my screen visible to everyone? Someone to notify me. There's the host help me to stop screen, throw some more light about the different types of vaccines that are manufactured. Msao Hikima through some light, I'm going to make some additional remarks and what you should really know about the different types of vaccines. So, Msao Hikima talked about the first type of vaccines, which are the live attenuated vaccines. The word live means something that is not dead. Then attenuated means something that has been weakened from its maximum potential. So it has been weakened. So these live or attenuated vaccines, they are vaccines that contain weakened live germs or microorganisms that cannot cause a disease, but stimulate strong immune response to a given disease. Now, they are just weakened, but they are live. So the most interesting question here about the live or attenuated vaccines would be, won't these live or attenuated vaccines infect the individual in case they are administered? First of all, they are weakened. So it's like those of you who watch football, it's like having a friendly match before having a final match. So in other words, this helps to boost you, to help you fight the incoming organism. So however much these are inactivated and they cannot cause a disease once administered, because their main role is just to trigger the strong immune response. However, they are contraindicated in some cases since they are still live germs. So cases where live or attenuated vaccines are contraindicated, we have pregnancy. So there is a risk of teratogenicity. Then we have patients who are severely immunodeficient. For example, those patients of AIDS or HIV that have the CD4 levels that are really below 200 cells per cubic meters. Then we have those patients that have severe allergic reactions, and then also those that have undergone recent blood transfusions. So those are the contraindications of these live attenuated vaccines. And examples of live attenuated vaccines, we have the MMR vaccine, the measles, mumps, and rubella vaccine. We have the yellow fever vaccine. Now, this is a requirement for most of the inland or outside travelers from the endemic areas. You know, Uganda is one of the WHO recognized endemic areas for yellow fever. So people normally look for yellow fever cards. So yellow fever vaccine, oral polio vaccine, and the measles rubella vaccine, they are the live attenuated vaccines that we do have. Another type of vaccine that Musao Hikma talked about are the inactivated or killed vaccines. Now, these vaccines, for the live or attenuated, they are weakened. But for the inactivated vaccines, for them, they are killed versions of a germ. But however much they are killed, they still trigger an immune response. So another interesting question arises here. How can a germ that is already killed or inactivated really trigger an immune response? So the fact that these already killed germs contained proteins
Yeah.